Okay, we're rolling.
Okay. At this time, I'd like to call to order the Town of Ledyard, Connecticut Community Relations Public Information Forum on April 7th, 2021 at 6:30 a.m. Sorry, 6:30 p.m. At this time, the purpose of this public forum is to provide an opportunity to learn about the social services, youth services, and the Ledyard Prevention Coalition services that are provided to the town of Ledyard residents. So at this time, I'd like to pass it off to, we have three people presenting. One is Lisa Doozy-Smith, the other is Kate Sikorsky Maynard, and the other is Corinza Mansfield. Lisa will be doing the social services with Kate, and Kate will also be doing the youth services, and Corinza will be doing the Ledyard Prevention Coalition. So at this time, I'd like to introduce Lisa Doozy-Smith and let her begin. And Lisa, could you just introduce yourself? I'm going to have you three introduce yourselves before we start the presentation.
Sure. Hi, everyone. My name is Lisa Doozy-Smith, and I am presenting tonight because I am the chair for the Ledyard Social Services Board.
Thank you. Kate? Oh, Kate, you're muted.
Think that after a year of doing this, I'd know what I was doing. My name is Kate Sikorsky Maynard. I'm the Director of Youth Services for the town of Ledyard.
Thank you. And Corinza?
Hi, my name's Corinza Mansfield, and I'm a program coordinator with Ledge Light Health District. And one of the programs I coordinate is the Ledyard Prevention Coalition.
And just for the record, I'd like to acknowledge that we have Councillor Soms present, Councillor Ingalls present with the commission. Councillor Chairwoman Linda Davis is also here. Administrative Assistant Roxanne Mars here. In addition, we have the Mayor, Alan is also here. And we also have from the Massachusetts Pequot Tribal Nation, Crystal Whipple is here. So this time, I'd like to turn it over to Lisa, and the floor is yours.
Thank you. So, as I stated, I am the chair for the Ledyard Social Service Board. I was appointed to that position this year. So it's a group of newly formed volunteers in the town. We've had 2 meetings thus far. And so we're all still learning the ropes, me especially, of how a social service board operates. It's 7 members that represent the town, and we oversee the social service board, social services department, as well as the youth social service department. I'm sorry, I'm distracted. I'm having my dogs removed from the room because they were barking like mad. I apologize. So basically, the social services is for our community members, right? So myself, having sat on the board as a member past and now the chair, I've been a member of this town since 1980. I still wasn't really clear on everything that's available. My commitment to being on the board is, my strong commitment is what residents in this town need services can we provide to them, to the residents, and what barriers are in the way for them receiving those services. And that's the things that I would like to identify. We have wonderful volunteers in this town that spend countless hours donating, working in the food pantry, which I'm hoping Linda Davis can speak on after. And so I just want to make sure we're reaching them and all people to make sure that, you know, we can use all these good services we have. So today, for instance, a little unclear, I literally just walked into town hall and I thought, if I was a resident of Ledyard who needed services, what would I need to do? Because I'm not even sure, being the chair of the social service board, I completely understand that. And I thought it would also help me maybe identify some barriers that I could bring back to the board that we could remove in the future. So if a resident calls the town hall or walks in like I did today, they would be directed to the mayor's assistant, Kristen Chapman, who's with us this evening. And she would just do like the initial demographic questions, what their needs are, and try to, triage what is the most important thing affecting this particular resident or family. So at that time, she has options. She can, refer them out to other agencies such as United Way, TVCCA. She can just determine what, would be the best benefit for this particular family. We know that all families' needs vary, and we're not just talking about families. We're talking about senior citizens in our towns, single people. If there was a family with children who needed services, then she could make a referral to Kate with the YSS. Now, let's say that the family, needs more immediate services that the town can offer. Then she offered me the actual paperwork that they need to fill out. And in this paperwork, it's more demographic information and that also accounts for their income and proof of income so that they can be either determined eligible or ineligible for the services. So then what does that look like? So if they're determined eligible, then that means they have access to the services that the town provides. So that would allow access for the food pantry, and the other services that the town provides are things like the holiday baskets around Thanksgiving. Families can sign up for a food basket around Christmas time. They can get gift baskets for the entire family. There's a back to school backpack program that the town offers, which again, I just want to remind is also due to all the wonderful volunteers that donate the food, the gifts, the gift cards, and the backpack supplies. And then there's also the opportunity for families to apply for scholarships so that families in need, their children could attend the summer day camp, I guess it would be called, at the Parks and Rec program. So having completed what I would call like this vetting program offers a lot of opportunities for families. So I know that this year has been full of challenges, and I'm sure that it has affected the ability for folks to maybe get the needs that get their needs met. I am also, we spoke in the last board meeting, very aware that there are some families now having to seek out services that have never been in that position before. And so we have to consider that in different ways as well. So I'm going to stop there. That is what I have kind of gathered from today. I'm excited about this new board. There's a lot of energy on it, a lot of good conversation. I'm hoping that moving forward, we'll have more of a presence in town. But I definitely want to give Linda Davis an opportunity to speak about the food pantry before maybe then Linda can turn it over to either Kate or Carenza, if that's okay with you, Mike. But please, if anyone has a question for me, I'll try to answer it. If I don't know the answer, I'll try to find it.
Thank you, Lisa. At this point, bear with me for Linda. Did you want to speak about the food pantry?
I can keep it very brief, and then if anybody has any questions, that might be the better way to do it. The food pantry is the day-to-day operation of the food pantry is run by volunteers, and due to COVID, we have switched from a client choice pantry, meaning guests could come into the pantry, select what they like every other week or every 2 weeks, and that's how it operated. Due to COVID, we had to go to a drive-up pantry with pre-bagged food, and we weren't particularly thrilled to have to do that, but there was really no other option. So what we've done is we've kind of put out some carts to give people some options outside in addition to their prepackaged bags. Now, just last week, we went to a order form, which is totally new for us. And I think it's going to be a great thing for our guests because even though they're not coming into the pantry, they will have more choices. So the order form, which I'm happy to share with anyone anytime, the order form has a real wide range of things we offer. And then when they turn in their order form 2 days before pickup, when they get there, they hand the order form to the volunteer, or they pick up their bags that have been prepackaged from their order form. And then they get a selection of meat, cheese, eggs, and some other things that we offer. We often offer kits. Like this week, we have an apple pie kit where we offer all of the items that would go into an apple pie. And some people take those, some people don't, but they are quite popular. So we are blessed with adequate freezer and refrigeration space. So we get lots of eggs donated. We're in great shape there. We're also a member of the Connecticut Food Bank and Gemma Moran, where we get great variety of food. And then, of course, we have amazing donors. So we have lots of donations, gift cards, just many options for our guests. We have local nonprofits to donate, and it's been a really good thing and continues to be a good thing. The pantry has about 100 visits a month, and as many of you know, we'll soon be moving to the Morgan Barn, which was Plan D, and we're going to work around it as best as we can. Without water, without a bathroom, and without an upstairs. But we actually we'll soon have a toilet at least. So it's going to be a challenge. But we're happy to move and have a little more space. The hours are 9 to 11, Tuesday, Thursday, and Saturday. At one point, we were open Thursday evenings, but the number of people that came on Thursday evenings was so low, and it required extra volunteers. So we did eliminate Thursday with no complaints, really. And that's just a quick overview. We started, I guess I should mention that, for years and years and years, the food pantry operated out of Town Hall. In 2015, it moved over to the Ledyard Congregational Church, who hosted us generously for 5 years. And then we just kind of outgrew the space. And during COVID, the church has been very generous to let us use their church. But I suspect with everybody getting vaccinated that someday here soon, they're going to want their church back. So that was the impetus for the move. So I'm happy to answer any questions if anybody has any questions.
I have a question.
Yes.
Linda, could you just give us some examples of the number of food items that have been brought in during some of the larger collections like the Boy Scout?
The Boy Scout Drive brings in about 8,000 food items. And that is a lot when you really get down to counting and whatever. But we get a lot of even 1,000 of food donations, 500 donations. We get up to about a month ago, the Gales Ferry Church, Our Lady of Lourdes, had their lobby open for donations, and we were probably getting 1,000 donations a month from there. The Rotary gave us many, many donations. So you're right, Bill. It was to have mentioned that it's a lot of donations. We're very fortunate. We rarely have to buy food, although we do buy some food because there are certain items we don't get much of. Sugar is an example. We don't get too many donations of sugar. We do buy most of the cheese because that's not provided for the most part by Connecticut Food Bank or from Gemma Moran. So we do buy cheese. We have, oh, Bill, you'll be interested in this. Mike Lamb, for the third year, is
I saw
donating
that.
a steer, and we will get 400 or 500 packages of 1 pound packages of ground beef. So, I mean, I don't know how we could ask for anything much more than that.
Linda, as far as eligibility, how is that actually determined for an individual? So they would go see Chris, bear with me, I've got the list stuff on my page here. They would go see go to the town hall.
Yes,
So would they be filling out paperwork?
yes.
So you mentioned about, okay, so is that the salary? Is that the income based? Is it the household, total household? How is that ascertained?
It is income based. I personally don't vet clients, so I'm not, and poor Kristen is brand new, so I'm not sure she can help.
Yep.
She might be able to, but it's mostly income based. But yeah, when things like COVID hit, of course, we were very lenient, because if somebody said they just lost their job, clearly there's no way to, if you check tax returns or things like that, it apply. So we look at they look at the individual situation. So you know that anybody that comes to the food pantry gets food, whether they've been to town hall or not. We don't know who the people are. We don't have names. If they show up and say they need food, they get food. Even if they don't live in Ledyard, they get food. Because Gemma Moran, a lot of the foods we get from them, there is a restriction that anybody can have access. So we don't know who the people are if they show up. We don't get a lot of that, but during the beginning of COVID, we had a lot of people just show up wanting food, and they were all given food.
Thank you. Any other questions for Councilor Davis?
Can I ask a question?
Yes.
Yes.
So I know you said you're open on certain days and hours. How do you make sure that people get access to food if they can't be there during those hours?
Oh, thank you very much. We do deliveries to seniors or anybody homebound. But for instance, last week, someone messaged saying that their car broke down. We delivered. We have lots of wonderful volunteers, and we deliver. We have one woman that those hours did not work for her, and I'm there Monday, Wednesdays, and Fridays, stocking and doing things like that. So we'll see somebody during the off times if we need to.
Perfect.
Brad, you had a question?
I just had a clarification on the application process. So we follow the state of Connecticut's income guidelines. And so if somebody qualifies for SNAP benefits, they are typically going to qualify for food pantry assistance and other assistance programs that we have.
Thank you.
Thank you. Any other questions? Anybody have a question? Feel free. Okay, this time, seeing no additional questions, Kate Sikorsky Maynard, would you like to now do your presentation?
Yes, so Roxanne is pulling up my PowerPoint right now. Thanks, Roxanne. So I'll be talking about Ledyard Youth Services. My name is Kate Sikorsky Maynard. I'm the director of Ledyard Youth Services. I don't think I can control the PowerPoint, so I think Roxanne's gonna have to do it for me. So we'll go to 2. Oh, I can't. Yeah, okay, so Ledyard Youth Services is we are a town-based counseling services program. We're located at the lower level of Ledyard Town Hall. There is no referral needed to get involved with the Ledyard Youth Services counseling. So anybody in the town of Ledyard, any parent of a student that goes to any of our Ledyard schools can call Ledyard Youth Services directly to request services at any point in time. So there's no referral needed. We do get a lot of referrals from our schools in town. However, that's not required. So at any point in time, a family can call for services. Okay, I don't know what's going on. Roxanne, what is going on?
I'm trying to get the slideshow to go.
There we go.
Okay, so it's Ledyard staff. So as I said, I'm the director and supervisor for the program. I'm a licensed marriage and family therapist. I'm a certified substance abuse counselor, and I am the American Academy of Marriage and Family Therapy approved supervisor for the site. Our marriage and family therapy counseling is provided by our master's level interns. So we have usually 2 to 4 interns a year in their second year of their master's program. And they come from either University of Rhode Island or St. Joseph's University currently. We have had a social work intern in the past from Sacred Heart. And in the past, we've also gotten MFT interns from UConn. However, UConn's program closed down. So that was kind of one program that's not placing interns anymore. 2 to 4 interns per year we try to have. And our interns work for a stipend. So they are offered a $500 stipend for every semester that they complete. Our interns are here for 2 semesters usually. So their maximum stipend is $1,000 for their entire year of work here at Ledyard. So a market value, so this is just an idea of the value that we get out of our interns working here, because the town does not pay the interns outside of that $1,000 stipend per intern. So the market value for an hour of clinical services provided by an intern is $25 per hour. Each intern that works here at Youth Services has to complete between 400 and 500 hours of client contact prior to the end of their 1-year internship. That 400 and 500 is flexible because at URI, they have a clinic there. So they're also seeing clients at that clinic. However, at St. Joseph's, they do not. So that intern would have to complete the complete 500 hours here. So that's why that hours is a little flexible. So each intern here placed at Ledyard is a value to the town between $10,000 and $12,500. And remember, we're paying them $1,000 for that year. So the town is really benefiting from those services without having to pay out much money. Currently, Ledyard Youth Services has 3 interns with a total value of approximately $30,000 to the town. The services that we provide, so we provide individual, couples, and family therapy. Again, there's no referrals needed. So anybody that lives in the town of Ledyard or any students that go to any of our Ledyard schools can call directly to get involved in services. The counseling services are provided by our Ledyard interns. However, I also provide services to families as well. It's a free service to families who cannot afford the $5 per session fee. During COVID, we've waived that $5 fee, so all of our services are free to any families involved. Right now, we're providing all telehealth services, but really hoping in the next couple months that we'll be able to get back to our in-person services. However, we'll continue to provide those telehealth services for the families that feel like that's a better benefit for them due to transportation or timing or multiple jobs. So that piece I don't think will go anywhere. However, we do really like to have the families here in session with us. We also provide school-based counseling. So clients are seen in the school environment during the day. The clinicians work really closely with the family and with the school to make sure the needs of the client are being met in that school-based counseling. That can also be paired with family therapy as well. So we might see a kid in school on a weekly basis and also see the family every other week in the office. We also provide educational groups in school. Those topics change from year to year based on the needs identified by each of the schools. But in the past, we've dealt with issues like groups of kids working on anger management, working on conflict resolution, self-esteem, body image, social skills. We've provided lunch bunches to the 1st and 2nd graders, which focus on social skills, but it's during their lunch period. We also provide parenting programs. So we provide a STEP program for effective parenting. We also provide parenting programs for teens. I mean, not teens, teen parents, but parents parenting teens. We also provide parenting through divorce, blended family, and anything having to do with any family transitions. We're also a referral base. So if a family comes or is referred to our services and needs additional services, or we don't feel like the services that we can provide to the family are to the need or to the level that they need, we will provide them with referrals to the services in the community that will better fit their needs. So this is just some data. So during the fiscal year of 2020, Ledyard Youth Services provided counseling to 83 individuals and families. This is actually lower than in years past. When COVID came, we had full caseloads. However, I think many families felt like, okay, it'll be like a month or two and we'll get back in the swing of things again. So they kind of fell out of counseling for a little bit. And then kind of when it dragged on and on and on, it was tough during that time. So we've had lower case family numbers than in years past. However, I do think once things kind of pick up again and seem a little more normal, we'll get more referrals coming in. Between July 1, 2020 and March 8th of 2021, we had a total of 1,134 case contacts with families. So that includes individual counseling appointments, family counseling appointments, phone counseling appointments, and collateral contacts. So that could have been meetings with the schools. We support families in IEP meetings for any special education services if they request our presence there with them. We want to make sure that the family feels supported in those environments as well. Ledyard Youth Services is supported financially by the town government budget, as well as a $26,000 yearly Department of Child and Family grant, which is intended to support the youth service bureaus in Connecticut. I'm part of the Ledyard Social Services Board. So this is our mission statement, which is to enhance the social and emotional health and quality of life for all Ledyard residents. Youth Services promotes the health and development of Ledyard youth and their family through professional programs and counseling. Social Services offers support through advocacy, information and referral services, temporary assistance with basic needs. All services are provided with respect, confidentiality, and the goal of promoting self-sufficiency and well-being. And the board is made up of community volunteers, as you already heard from Lisa. Ledyard also has a juvenile review board, which I'm the case manager of, and an attendance review board, which I'm the case manager of. The idea behind these community-based diversion programs is to keep kids under the age of 18 who are first-time offenders or not of nonviolent crimes out of the juvenile justice system and provide them with community supports or provide the family with community supports to help move that kid in the right direction. Because as we all know, teenagers make mistakes. We know this. We don't want to penalize them and get them involved in that juvenile justice system right off the bat. We want to provide them with any supports or services or counseling that they might need to help them move past this point in time and keep moving forward positively. And the attendance review board, I work really closely with the high school right now and working to get services for the families that are struggling with their kids getting to school or engaging in school. So that is what the attendance review board is for. This year, both the juvenile review board and the attendance review board have had lower numbers than in years past. From talking with the chief of police and some of the police officers, they're really working with the families during COVID, and kids aren't getting in trouble as much at school right now because up until a few weeks ago, there weren't as many kids in school. So we've had lower numbers referred to the JRB. Truancy has been more of a concern, I know, just from talking to the social workers at the schools. However, those referrals haven't really come in. I think the schools are trying to figure out, how to wrap services around those families before sending them to the attendance review board, which is the policy anyways, that schools really need to do everything in the best interest of the family and reach out to the family several times prior to any referral to the attendance review board. Okay. And I'm also a community partner for the Ledyard Prevention Council, which Corinza Mansfield's going to speak about next. So the mission of the Ledyard Prevention Council is to foster a healthy, safe, and drug-free environment for Ledyard youth through community partnerships. So they meet monthly, and I'm part of that coalition as well. So that is my spiel, and I would be happy to answer any questions.
Okay, I have a question for you. You mentioned about the juvenile review board.
Yes.
Is there any connection between, and I may not say this right. So if, say, for example, you have a youth and something takes place and someone calls the police, Is there a relationship between the police department and the juvenile review board? So the police department says, wait a second, let's get you to the juvenile review board. We're just going to give you a ride to wherever you got to go, back to your parents, and we're going to set something up to go through that process.
Yes, so that is a huge part of the JRB, is that we work really closely with the police, with the Ledyard police officers. They have a referral form that they all carry around with them. So if there is a situation in which there's a minor that gets in trouble, either at school, in the community, at home, they have that referral form, and I'm sure that they talk to the chief in regard to cases that come in front of the board to make sure they're appropriate cases. But yes, hopefully, our hope is that every juvenile in the town of Ledyard who's a nonviolent offender under the age of 18 would have the opportunity to come in front of the JRB versus going into the juvenile court system.
And one other question I have is just on the issue of confidentiality. Could you speak on that really quick?
Yes. So all of our members on the board are made up of some community members, some school personnel, police chief, Karenza Mansfield's on it, I'm on it, there's a probation officer on it. And when you come onto the board, you have to sign a confidentiality form stating that everything that is discussed in the meeting is confidential. It doesn't leave the room. It's not spoken about with any of the other families that are ever involved. So that form is signed by every member of the board on a yearly basis. So every year we go through that confidentiality piece and sign that again. And that's just for JRB and the ARB. So that's also the attendance review board also has that confidentiality piece. And then Ledyard Youth Services for the counseling piece also has confidentiality as a legal stipulation as well.
Thank you. Do anybody have any questions for Kate? Yes, Counselor Ingalls.
Kate, I asked you this question when we were prepping for this, but I wanted to ask it again in this venue. And that is there something that you do that you really wish the community knew more about so that they could take better advantage of it?
Right. So I think the biggest thing that I want everybody that's here, and if you go out and talk to anybody after this, to know is that anybody in the town of Ledyard can request services from Youth Services at any point in time. So all you have to do is look up the number and give me a call. There does not need to be a referral from anybody, even if it's just, I have a question about this type of service, or do you know where to get this type of service? I'm more than happy to do any research that I can to help any families in the town of Ledyard get the services that they need, or provide the services through Youth Services if that's a good fit.
Great, thank you.
Yes, Counselor Soms.
Thank you, Mike. Kate, are there any youth mentoring programs in the town of Ledyard that you're aware of?
There are not any youth mentoring programs. In years past, they've used some Boys and Girls Club through the elementary schools for some mentoring, but currently there's no mentoring programs in Ledyard.
So the follow-up, kind of like Councilor Ingalls' question, should there be? Do you wish there were?
I definitely, for our ARB and our JRB piece, we've talked, I know in our meetings, when we're trying to set up services for some of the kids that come in front of us, how important a mentorship would be in that type of environment. And for those kids, even if it's just somebody to sit down and, keep them on track doing homework, or, get them out of the house for an hour to do some fun activity. So we've definitely talked about the need for that. To help our kids out. So I always think that there would be benefit in mentoring. There's no downside to a mentoring program.
Thank you.
Any other questions for Kate? I'm trying to scroll through and look at names. Okay, well, thank you, Kate. At this time, I'm going to get your name wrong. I always do. Karenza? To talk about the Ledyard Prevention Coalition?
Sure. All right, I'm going to share my screen. Let's see. And where is it? Here it is. Okay. All right. Well, thank you for having me tonight. So I will be talking about the Ledyard Prevention Coalition. So just to give you some background information, the coalition was actually established back in 2007 by some staff members from Ledyard Health District. They wrote letters to community members trying to get people involved in a coalition to prevent youth substance use. And in May of 2007, we did our first comprehensive youth survey for students in grades 7 through 12 under Mike Grenier, the old superintendent, who is very supportive of this. And based on the survey results, we found out that the survey said that alcohol was the drug of choice. Based on our data, we wrote a grant application to the federal SAMHSA, which is a federal agency, and we were awarded a drug-free communities grant. And once we were awarded this grant, not only were we able to focus on the prevention of youth substance use in terms of alcohol, but also prescription drugs and marijuana. Oh, and then most recently, we were awarded the second round of funding for an additional 5 years. So over the course of 10 years, if we achieve all our deliverables and continue to evaluate our work, we're looking at over $1 million that has been brought to the town of Ledyard over the course of 10 years for youth substance abuse prevention. I think this is really important. So this is the science-based approach or evidence-based approach that the coalition follows, which is actually prescribed by SAMHSA. It's something that we need to implement, and it's called the Strategic Prevention Framework. So basically, it's an ongoing process, and you kind of start with your assessment. And once you know the needs of the community, you build your capacity, you start planning programs and talking about what you're going to change in the community. Once you have your plan in place, that's when you begin implementing. And then, of course, you always evaluating is ongoing, evaluating your programs and all of your efforts. And then in the core of it, we're always trying to think about what we can do to sustain the coalition and to make sure we're reaching all populations of the Ledyard community. So basically, when we first came together, we talked about what could we do to really change, what could we focus our efforts on to change youth substance use? And again, some of this language is prescribed by the people who provide our funding. But we thought we could really make some change in terms of increasing the perception of harm of alcohol, prescription drugs, and marijuana use. And we thought we could also decrease peer and parental acceptance of prescription drugs, alcohol, and marijuana use. And we do this by implementing environmental strategies, policy changes, and a lot of educational campaigns. Again, our drug-free communities grant that we have, they prescribe our goals. And there's two main goals that we have to, that we focus on. Number one is to increase community collaboration. They really want to make sure that we have all community sectors on board and participating. In one of Kate's slides, she listed all of the different sectors that are a requirement for us in order to receive funding. And they're called the 12 community sectors, which are parents, youth, faith, community, government, police, tribal, healthcare, youth serving organizations, schools. I'm not quite, healthcare, I said that one. I don't know them all off the top of my head, but there are 12 that all need to be participating in order to receive funding. So these are some of the objectives that we're working on to increase community collaboration. The second goal that is prescribed by our drug-free communities grant is to reduce youth substance use. So we kind of broke them out into our alcohol objectives, our marijuana objectives, and our prescription drug objectives. So you can see what they all are. Again, this is for just the town of Ledyard teens or youth ages 12 to 18. So here's our 2021 proposed action plan. These are some of the things that we will be doing. Our timeline is a little shorter this year because of COVID. We only have 9 months to do all of this versus 12 months. So some of the things we've been doing for a few years now, so it's kind of nice is we have it on our calendar and we're up and out the door and, we can do these things, but, some of them are a little bit more challenging. So as part of our coalition, we have the funding from the coalition funds my position, and we also have a youth coordinator who does a lot of work in the schools. Right now, we are actually working with Mashantucket Pequot Tribal Nation. They have a grant. It's their High Five program, and our youth coordinator actually participates in their program and kind of does some prevention skills and building protective factors. And he follows a curriculum that we found online and, really gets out into the community, talks about what they can do to not engage in substance use. We also work at the Ledyard Middle School. There's some free time where some kids are in the library and our youth coordinator is in there, and they have the opportunity to create some prevention videos. We collaborate with the high school to recruit 7th and 8th grade to establish leadership and team building groups, which is interesting. We're talking about mentoring. And I'm thinking if we could kind of streamline what we've kind of been doing into more of a mentorship program, that might be a really, really good idea. A new initiative that we just started was collaborating with the Navy School youth, again, to develop some educational campaigns around, why not to use, again, increasing that perception of harm of using drugs. And so they're starting to work on that right now. We engage youth in participating in our national prescription drug take back programs, which happen twice a year. Our next one is coming up on April 24th. This is a national event that the DEA sponsors. And like I said, it happens twice a year. And April 24th, we will be at the police station. We're going to start advertising actually next week about bringing your unused prescription drugs and dropping them off at the police station. And lastly, we support and participate in school activities. That, that again, those positive things that go on. So these are just some pictures of some of the things that we've supported in the past. We've brought in motivational speakers, talking about, why you shouldn't use. And we took some kids up to the Capitol one time to talk about the marijuana bill. We've purchased books for the library on substance use prevention. So all kinds of fun things. So this is a fun thing we've been doing too. For the last year we didn't, but 2 years prior to COVID hitting, we took 7th and 8th graders that participated in our coalition at the end of the year to the ropes course training that they have. And it's a leadership training. This was kind of to reward them for their work with our coalition. Again, here's our prescription drug take back day that happens in October and April. Here's some of a picture of some of the drugs we've collected. We haven't actually had something to weigh it exactly, but we've gotten, well over 100 pounds in the past, just in a 4-hour time frame. And then you may have gotten this in your mail. This went out, let's see, we are in April. This went out a while ago. This was just kind of a little report talking about what we do and the problem, what we do, our mission, our vision, and a little bit of some statistics. And this went out to, I'm not sure exactly how many households, but we try to get it to as many households via mail. By not sure of the exact number, but it was a lot. And that's it.
Does anybody have any questions regarding this presentation? Yes, Mayor Allen.
Carenza, did you want to put in a shameless plug for the Like movie for tomorrow?
The Like movie.
Yeah, I thought that came from you. Like it was by social services, or Kate, you maybe
Yeah,
I'm sorry, I had you confused. My apologies.
so Ledyard Youth Services has partnered with community YSBs, New London community YSBs, to purchase the Like film. It's an indie film about social media for the town. So any member in the town can watch this film at any point in time. It is on the town website. It's also on the Parks and Rec website. I've advertised it through the superintendent at each of the schools, and hoping that some kids will be watching it and some parents will be watching it with their kids. It is a free screening. Tomorrow there'll be also a discussion after the screening. I believe the discussion's at 8 o'clock, maybe tomorrow night. The screening's at 7. But again, if you're not able to attend that screening and that discussion, you can just go and watch it. But tomorrow is the last day that we have the film purchased for. So please go and watch it if you are interested. Thank you, Mayor, for reminding me.
Absolutely. Yeah, I just watched the trailer on it, and having younger kids with devices in their hands all the time, I watched the trailer and I'm like, yeah, I get that. So yeah. I'm definitely going to that tomorrow.
Yeah, actually the Ledyard Prevention Coalition has brought in screenagers in the past, which is, it sounds like it's very similar to this. So I'll definitely check it out.
Oh, cool. Is there any other questions? Does anybody have any questions? Okay, then at this time, I first I want to say just a heartfelt thank you on behalf of the Community Relations Committee for Lisa, Kate, and Carenza coming and doing a presentation. It's greatly appreciated. I'm amazed how much I've learned. I've only lived in Ledyard since 1974, so you would figure I'd know most of the stuff, or at least a little bit of it. But it's really been eye-opening. And what's great is it's a lot of services that are available through to the town, and that kicks across the whole community. And it ranges from, we have military, we have the Mashantucket community, we have people who have been here long-term, and people who've been here only a year or two. And there's probably a lot of the people do not know of these services that are readily available. And it would be a great opportunity if everybody here who's on can mention this or do something on their Facebook page just to say, hey, you know what? These services are out there. They're confidential. They can assist you. It's not, some of this stuff is need-based, but as Counselor Davis said, when people are hungry, you don't turn them away. It's one of those deals. And especially in this time where a lot of kids are, unfortunately, some of them are struggling mightily with this COVID situation, being isolated, and just kind of keeping an eye on the youth. So there's probably kids out there who could definitely be using a lot of these services who probably don't get them now. And it's because they probably don't know, or their parents may not know. And the truncated situation with the schools don't really get that much contact. I got 2 boys in school, and I watch what they do, and it's really the school does the best they can, but it's still very much disjointed. So if everybody could reach out to and others in the community and let them know of these services, we'd greatly appreciate it. At this time, I want to give an opportunity for if Lisa, Kate, or Carenza want to say anything before, and then I'm going to leave it to the counselors, Ingalls and Counselor Soms, if they want to add anything in. And I want to just mention really quick, I know I'm going fast on this, and I just want to mention Crystal Whipple from the Mashantucket Pequot Tribal Nation, who works with us. We've had meetings with the Mashantucket Pequot Tribal Nation, and all this is really about making sure we get the services for all the people of the community and who need help, and that nobody's turned away and nobody is left on the outside looking in through the window. And with that, Lisa, Kate, Carenza, do you have anything else you want to say?
I just want to say thank you for having us. And I think you made a great point at that last point. Like anybody should be able to get these services no matter where they live in town. So I think it's great that Mrs. Whipple is here because that's a great representation because these services are for anybody. I know that Mashantucket Tribal Pequot Nation has some services of their own, but there's definitely families that we've worked with that are from the tribe, and they appreciate the services that we have, and we always welcome anybody to utilize the services at any point in time.
Right. And I would just like to say thank you as well. And if anyone would like more information about the coalition or would like to join the coalition, please contact me. Mayor Allen has been very supportive and attends as much of our events that he can. So thank you.
Lisa.
I just wanted to say thank you too. I was looking forward to this meeting, and I appreciate all the education that I received tonight as well.
Councilor Psalms or Councilor Ingalls? Any comment?
I appreciate these ladies for the work they do. I'm ever impressed by the number of volunteers in this community. It is a phenomenally generous community. People give of their time and their resource. And for a small town, we sure do offer a whole lot. And I think it's just important for us to know what's out there so we can know how to help our neighbors. And there's just not a lot of reason to do without in this town. What you need is out there. So thank you, ladies.
Councilor Psalms?
I can't say it any better than that. Thank you all for what you do.
I'm going to also reach out to Chairwoman Davis.
I have nothing to add. I think you all said it brilliantly. And I would echo what Andra said, though, about the generous community we have. It has been absolutely incredible as far as donations to the food pantry during the COVID crisis. When the first round of stimulus checks went out, we received thousands and thousands and thousands of dollars, and they all were right around $1,400. So we knew exactly where those checks were coming from. So I can't say enough about this community.
And Mayor Fred. Mayor Allen, sorry.
Yeah, no worries, Mike. No, I thank everybody for joining tonight, and I think each of these meetings that you have held, Mike and Bill and Andra, have been tremendously helpful. As much as we, internally may think that we get the message out there for the availability of services, sometimes we don't do a good enough job, and we can always do better. So having other people on here and explaining what it is that we can provide and how help can be offered, I think goes a long way. And we've got a lot of people on here that can share that and make for an even better community. So thank you all.
I'm going to do a shameless plug now for the Community Relations Committee. First, since this is recorded, it's available for anybody at a later date to come and listen to the discussions. So the information is there if anybody's wondering. And the other part is the Community Relations Committee. We're going to be putting together another round of an public informational to talk about other services. We're not quite sure which ones we're going to do because there's a lot of things we're finding that we want to do, but we have one or two more left in this year to do, and we hope everybody will participate. And I want to give a quick shout out again to Mrs. Whipple, who has been very gracious with the Mashantucket Pequot Tribal Nation, who's come to many of our community relations meetings, and we meet with them on a quarterly basis, roughly, depending on what we're working on, to kind of just keep everything going well in the group in general. Crystal, was there anything you wanted to say?
Yeah, I just wanted to thank all of you for the invitation. This was very beneficial to me, very informative. I think that the residents of Ledyard are very lucky to have all of you. You have some pretty amazing services. As a leader of another community, just looking at what you all do is pretty amazing. So hats off to all of you. I personally have had experience with your youth services department, found them to be very helpful, very confidential. And so again, I just thank you all for the invitation and look forward to more collaboration. I was happy to see the Ledyard Prevention Coalition working with our High Five grant program. That was very nice to see. So I'm gonna go through my notes and maybe look to some other areas of collaboration, and we'll talk about it in the future. But thank you all.
Thank you. And with that, I'm going to, does anybody have any other questions or comments?
I do have one question.
Yes.
So speaking to anybody for a resource in the community, how do you work to break barriers and be culturally competent to anybody in the community?
Well, that's a big draw. I'm not quite sure how to answer that, and the reason probably is a function of, we've talked in the Community Relations Committee, and we've talked about the services and the fact that if you live within the town, or you're a resident of the town, that if you qualify for the service, you should get the service. Some of them are need-based, and even those that have a money content to them, I think there's other workarounds. So you have to pay a little bit of something. But the expectation is, and the reason for doing this is so that people understand that if you live in the community, regardless of your race, your creed, your gender, your sexual, that is not a topic of discussion relative to if you get services or not. Only thing you need to do is be a human being who shows up in the town of Ledyard who's needing services. And I don't think there's any reason or any basis to deny somebody services at any given time who comes to the town and they qualify for the service. Okay, not everybody, and I'll put this out there, not everybody will qualify for every service on a free basis, but it's not unreasonable for everybody to be able to qualify for the service. Okay, so there's a distinction there. You know, I personally, I've been very lucky. My family has, because of the COVID. My wife works in the medical community. I work for Connecticut Department of Transportation. I personally COVID was terrible. Work-wise, it was good only because everybody's off the road. So I worked a lot. My wife worked a lot. So our perspective is, on a personal level, is we donate the services because we had the ability not to have to need the services, you know, and as everybody's already said, this town has been excessively gracious and very giving. So if somebody were to have an issue and they went for a service and they got denied a service, I think that would be something they'd have to go to the mayor's office. Stop me if I'm wrong here, Mayor Allen, and lodge that issue. But at least before going to the mayor, I would say, if someone went to a service and said, "Hey, Councilor Washington, I went for a service, I got denied," my first question would be, did you go to the person who's in charge of the service? Okay, because sometimes a person may get denied a service. I work for DOT, I'll use this as an example. We've denied somebody something at a certain level because people up the down the food chain may not have known the full scope of what was supposed to be done, and it was inadvertently not provided. And once they questioned at a higher level, it was like, wait a second, you are entitled. You should have gotten this, you should have gotten that. So part of the process is anybody, regardless of gender, race, whatever, they should be entitled to come and seek services, and a determination will be made if they qualify for the service. If they don't qualify, there'll be a frank discussion on why you don't qualify. Okay, so I'm not sure how best to answer your question, because my expectation is if you show up for a service, you should be able to get the service. So I don't know how any of that. It shouldn't be an issue of cultural background. That should not be playing into this. If you're a Ledyard resident, you're entitled to services.
I would just like to add, at least, you know, for the Ledyard Prevention Coalition, part of what we do for our members, when we go back to that little graph I had showed, cultural competence is in the center. And we provide a lot of education and training around cultural competence. It's way beyond just race. You know, we really try to understand the different cultures in the community, how to understand them, and so they feel welcome and heard, and, you know, cultures are different and we need to be sensitive to that fact. So we always have ongoing education around cultural competence.
And then I can speak to our juvenile review board that in this past year, we've really focused on, we brought in a speaker to speak to our board on social justice. We also brought in a restorative justice training, which is a special kind of way to kind of circle around the family and support them no matter what. So we've been providing restorative justice trainings to our members. There's 2 levels of that training. I've done both. I think Carenza might have done both of those trainings, and then most of our members have done the first level of that training. And then we also, during one of our meetings, that we didn't have we didn't have a hearing, so we had everybody come together and we had a speaker come and do a social justice training for us during that time as well.
And the other piece I might add to that too is that the Youth and Social Service Board, part of their charge is outreach. And to that end, if this is something that you're interested in, Jillian, we welcome you as a volunteer, and as positions open up, feel free to call me, come into the office, make an appointment, let's sit down, let's talk about it. And when there is an opening available there, I would be happy to put you on there.
It would be good to see young people getting involved. It's always good. I'm old, so I can say young people. Okay. Well, that being said, at this time, I'd like to thank everybody who participated. It was all great conversation. It'll be information that I think will help the Community Relations Committee moving forward. And I would just want to say thank you for attending. With that, I'm going to call this public informational concluded. Thank you, everybody.
Have
Good
a
night,
great day.
everyone.
Thank you, everyone.
Thank you.
Good night.